Good afternoon, everyone. My name is Dr. Blewa Manasseh Stephen, and I am from Gulias College of Medicine, Section 2D. Today, we are here to make a video on venipuncture and phlebotomy. Before we start that, there are some items that I would like to show you. So first, we have to get our gloves at all time because of safety and also for the patient's safety as well. And we also have our cutting board which we will use during the procedure. And here also we have our 5 ml syringe which we will be using to carry out this procedure. And the next item is our test tube, which we will be using after drawing the blood. We will be putting in our sample into the test tube. So next also we have extra surgical gloves because you cannot be too careful as a medical practitioner. There might be some mistakes, and of course you will need gloves at all times. Okay. So here we also have our alcohol, 70% alcohol, which we will be using throughout the procedure to make sure that our operation today is successful. Okay. So before that, I would like to introduce our patient. So whenever a patient comes to see a doctor, the practitioner has to take permission or consent from the patient in order for the operation or whatever to be successful. So because of that, we are going to introduce our patient, or will allow our patient to introduce him or herself. So good afternoon, sir.
Good afternoon, Doc.
Okay. So please, may I know your name?
Doc, my name is Musa Mohammed Mancha.
Okay, nice to meet you, Mr. Mancha.
Nice to meet you too.
Okay, so Mr. Mancha, please can we know your age?
I am 29 years old, Doc.
Okay, that's good. All right, so after doing that, we already know our patient's name and also his age. So the next thing that we are going to do is, before any procedure, we need to make sure that our environment is clean. And for that, first I will put on some alcohol and make sure that I sterilize my hand properly before I put on my gloves and start the procedure properly. Okay? So the first thing I will do is to wear my gloves. Okay? And it is important that we do this at all times because gloves are one of the most important and also sensitive things that doctors use, because sometimes you may have a needle that will puncture, and because you don't want your patient to feel uncomfortable, so you need to make sure that you wear your gloves at all times. Okay? So so now I'm done with my gloves. So the first thing we will do is, so the consent now. Okay, so Mr. Mancha,
Yes, Doc.
we are going to perform a procedure today which is called phlebotomy,
Yes, Doc.
venipuncture,
Okay,
which
Doc.
means I will be taking a sample of blood. I will be drawing blood from your arm for further testing.
Okay, Doc.
So is it okay by you?
Yes, doc, it's okay.
Okay, thank you very much.
Yes, doc.
Alright, so after taking the consent, the first thing we will do is to clear out the space and the environment in which we will be performing the procedure. So the first thing we need to do is make sure that our environment is clean. Make sure that there is no germs or dirt in order for the patient to feel relaxed and comfortable during this procedure. Okay? So after doing that, okay, anything we use, it's proper that we discard it discard it on the trash can so that it will not cause further damage, because germs are everywhere. So we need to be extra careful to make sure that we don't put the patient in harm's way. Okay. So now the next thing is, sir, can I have your arm? Thank you. So in every procedure, we will be taking the blood now. So, but before that, there is what is it called? We will be using a tourniquet. Okay, so this is a tourniquet, and then the purpose of using a tourniquet is to make sure that when we tie it above his arm, then it will provide a venous filling in the arm for us to be able, or for me to be able to see his vein and to be able to draw the blood properly. Okay, so the another important thing is that we need to take note also of the venous supply in the arm. Okay, so there is the basilic vein, which is located at the medial part of the arm, and also there is a cephalic vein that is located at the lateral part of the arm. But then the most important vein that we are supposed to be taking blood is located in the antecubital fossa of the arm, and the vein is called the mid cubital vein. So it is the most important because it has more protrusion and it is located in the central part of the cubital fossa. Okay, so having known that, now we will apply our tourniquet in order to be able to make our vein visible. And also, we should always remember that we have to tie our tourniquet 2 to 4 inches away from the antecubital fossa. So, having tied our tourniquet, and it is important that tying the tourniquet is not something we should do very hard. You should just have to apply a little pressure so that your vein will be visible. Okay? So having done that, the next step is that we will be applying some alcohol to be able to clean up the sites in which we will be inserting our needle or our syringe. Okay, so the proper way also is cycling outwardly. So we need to do this in order to make sure that the area in which we will be inserting our needle is clear and free of germs. So also we discard this all the time so that we make room for cleanliness. Okay, so having done that, we will have to take our syringe, our 5 ml syringe, and then, so before we do that, I will tell my patient to make a fist. Okay, to make a fist like this, so that there will be a pressure applied on the forearm in order to help protrude the vein outwardly and visibly. So having done that, we will take our syringe and then I'll try to insert the needle at 15 to 30 degrees angle, so that I will be able to, I will avoid puncturing the vein downwardly. Okay, so after inserting my needle, then you will notice that there will be a rush of blood into the needle. And then when you see that, and I will tell my patient to release his fist in order to allow the pressure on there. And also, since pressure is applied both sides, I will also release my tourniquet so that the pressure will not cause the blood to rush either way. So after that, I will try to draw the blood on the sample. Okay, then after that, I will gently use a cotton roll in order to make sure that this point of insertion will not cause harm to the patient. So after applying the cotton wool, then I will gently remove my syringe, and then with this I will tell my patient to fold his arm in order to avoid the rush of blood outwardly. Okay? And then with this again, we are going to discard the syringe because we have to make the environment clean. So that is all for today. This is the proper way of making the procedure in carrying out a venipuncture. So thank you once again. My name is Dr. Manasseh Stephen. Thank you.